In terms of then moving it to why that became good governance, why was there a message for lockdown in the West? How did that come about? It was departing from plans. We did have plans about advice and guidance and support, protecting people who were most vulnerable. That was the original pandemic plans, perhaps lost some of it in the organisational memory, but we never had plans for locking down. So why did that happen here? How did that happen here?
Well, there's two issues. Okay, so first of all, let's make it clear just how much of a departure it was. So the state of Victoria in Australia, which had one of the most draconian lockdowns in the world in the end, but actually published a plan for dealing with COVID at the beginning of March 2020, which Thomas and I mentioned in the book, and in it they recommended focus protection. They said, we will protect older people who are vulnerable. Who was that?
That was the health authority.
The health authority in the state of Victoria.
Yeah.
We will protect the older people who are most at risk from COVID, and also members of indigenous communities. So they made it clear that they were going to follow I think they might even have used, I can't quite remember, they might even have used the phrase focus protection.
Yeah.
So it was, which became, anathema and almost to be seen as an admittance of, being a genocidal eugenic follower of eugenics to follow such a policy. That was how it was put about in the media. But that was the policy as late as, March, the first week of March 2020 in the state of Victoria. So we moved completely away from that. Now, why did we do that? Now, I don't think Thomas and I come to a definitive conclusion about that in the book. What we want to do is actually chronicle what happened. So that's what the first part of the book is about. As a historian,
yeah.
Yeah, so it's a chronicle of the pandemic, is the first part of the book. And what we do, and because I think, this last 3 years has done a lot of strange things to a lot of people and a lot of awful things to a lot of people, but one of the things it's done is play with our sense of time, and I think it's quite easy to forget what happened. So what we've tried to do in the first part of the book is simply put down on paper what actually happened. And in that, we look at, the factors pushing towards the lockdown decisions, of which there are many. So first of all, there's the fear which emerged around COVID. And where did that come from? It came from various factors which we explore. Firstly, the way in which medical establishment had coalesced around thinking about future pandemics in previous years and how important they saw that in terms of global public health. That was one issue, certainly. But then it came out of also the fear was then stoked by, then there were these curious films of, people dropping dead in the street in China.
On social media.
And which we know people don't drop dead on the street of COVID now. That clearly was, and in fact afterwards those films were scrubbed. And what we say in the book is, we don't come to a definitive conclusion as to the origin of those films, but what we can pretty much categorically say is they certainly were a form of propaganda. We don't know what form of propaganda they were or who was behind that. But certainly what we can say, therefore, fairly objectively, is we departed from pre-pandemic plans. And there were powerful forces, some powerful forces at least, which actively wanted people to depart from pre-pandemic plans. And then on the other hand, I think we shouldn't escape.
Why do you, sorry, forgive me, but you say there were powerful forces that wanted us to depart. Where is the evidence for that? We don't know who did those videos, for example.
No, we don't, no.
So they may not have been powerful forces, they may have been just people in their bedrooms making things up, just to...
That's a fair point. I think a part of my view on that is, on the other hand, if we look, as a historian, I say, okay, let's look at the evidence. And one of the ways we do that is to say, who benefits from certain policy outcomes.
Yes.
And certainly what became clear by April and May 2020 was that there were constituencies within the tech industry in particular who were actively working to create the sense of a single unified narrative around this. Whereas one of the things we focus on in the book is a single narrative. So there clearly were powerful forces who very quickly took up the fact that there was one way to deal with this, and this way of dealing with it was lockdowns and then vaccines. Now, that's not the same thing as saying, of course, that those people were behind, but it certainly is to say that powerful forces shaped that very quickly.
And had a vested interest
in doing so because huge amounts of profits were made from it. And that's not the same thing at all as saying that those people were behind
No.
the videos, but at the same time, it is to say that there were powerful forces who were interested in different ways of dealing with pandemics.
Because in your book you do look at the profits, and I can't remember the numbers, but big tech did make a lot. I think there was a 50% increase in profits or something, and the pharmaceutical industry as well stood a lot to gain from lockdowns. So they were not against it.
No, I think we have to. There's various issues here. Firstly, we have to. I participated in an event fairly recently where somebody said, well, of course, they were in favour of lockdowns because, and this was a left-wing discussion, because it stopped capital accumulating. But of course, it didn't stop capital accumulating at all. What happened was by driving business online, it was guaranteed that it was going to increase inequality, because we already know that the internet is a place for creating monopolies.
Yeah.
That's quite clear. So by driving business online, you were going to increase the profits of the monopolies.
Yeah.
That's quite clear. So
and it did.
And it did. And in fact, the world's trillionaires increased their wealth within 2020 by $3.8 trillion. So I'll say that again. The world's billionaires increased their profits by $3.8 trillion in the first year of the pandemic.
Yes.
So that's a policy decision. Anybody, thinking about it now, we can see that is bound to have that outcome. Similarly, what we look at in the book, which is very important, is that the lockdown were one part of the equation. The lockdowns were always connected to the vaccine policy, and that's very clear. In fact, retrospectively, a number of figures said very early, we'll have to lock down until there's a vaccine.
Well, I'm interested in that, and I'll pick up on that in 1 minute. But one thing I just will get out of the way, there are a lot of people that say, wasn't Australia a success? They got away with it, as did New Zealand. They had, less deaths, and they pulled it off until there was an effective or relatively effective vaccine. What do you say to that?
Yes, I think that they are interesting examples.
And we could have done the same. Had we locked down earlier and harder, we could have been in New Zealand.
Okay, so there are various issues here. Firstly, the reason why Australia and New Zealand were able to do this was partly because they're quite isolated, partly because...
You mean geographically?
Yeah.
Mm-hmm.
Partly because it was summertime there, so the virus wasn't spreading in the same way as it was in the Northern Hemisphere in January and February. Mm-hmm. And so by the time they were able to close the borders, where that became a feasible policy, it was still feasible to try and curtail the spread of the virus. None of that was the case in the UK or in Western countries.
We're quite a porous nation, yeah.
A, there's that. B, there's a lot of evidence that the virus was actually spreading in January and February across Europe. So, and the fundamental thing that point fails to comprehend is that this was not the policy. People say we should have locked down earlier. Nobody was talking about lockdowns. Nobody was talking about lockdowns until the WHO report of February the 25th. That was the first time that anybody said this should be rolled out everywhere.
Well, some scientists were saying it, and they would say, had we done that, we would not be in the position
But
we're in.
it wasn't public policy.
Given that it wasn't, should it have been? Had we done that, would we have stopped the virus? Was there an alternative? That's really the question, not...
Well, I think we can look at what happened in Australia and New Zealand as a case in point. So what happened in Australia was, in fact, in spite of the most amazingly sealed borders, where no plane was allowed to take more than 33 people, sometimes less. And in fact, where people who weren't even Australian citizens were imprisoned on the island.
Yes.
So I know somebody they know, so a friend of a friend, was visiting his son in Australia and was not allowed to leave for 18 months.
Amazing.
Even though he's not an Australian citizen, he's a British citizen, he was not allowed to leave locked in for 18 months. So the most amazingly sealed borders, the fact of the matter was that they couldn't actually prevent the virus coming in. Cases kept on arriving.
Yeah.
That was why the state of Victoria had to have these incredibly long lockdowns at points. Because, and this is actually coming back to the question of how is this different to previous pandemics, because of the nature of global supply chains these days.
Yes.
The world is globalized. It requires global exchanges of food, minerals, and other objects which modern societies can't do without. And therefore, even the most hermetically sealed country like Australia couldn't actually prevent the virus from coming in.
New Zealand?
New Zealand again did have cases.
Did have cases.
Yes, did have cases because of the fact that ships had to come to harbour And however rigorous people are, there's human error and things happen.
But let's look at those countries through the lens of ethics and human rights. Maybe you could argue that it wasn't a success. You mention in your book that I think 1 in 10 people in the state of Victoria had suicidal thoughts.
Young people, yes.
And there were people who were quarantined, separated from loved ones, families. We also now have excess deaths in Australia, non-COVID excess
and New
deaths.
Zealand. Yes.
And New Zealand.
Yes.
So there was a collateral. So yeah, it depends on the lens.
Yeah, it depends on the lens you're looking at it through. I mean, so that if we make a summary of that, these policies wouldn't have worked in almost any other country in the world, because by the time it became feasible to consider such a policy, it was too late.
Yeah.
They couldn't prevent the arrival of the virus, even if you'd continued those policies for a decade or more, because of the nature of global supply chains and the requirement that people have for them. And then there are the collateral issues which you discussed.
Which we've discussed.